I'm Matt Lewis with MLF Legal, and I'm out at Injury One today, a clinic here in North Dallas that treats workers' comp patients and those who've been injured in personal injury claims like car wrecks, that kind of thing. And I've got Dr. Desiree Fleming here to talk about her role in this clinic as the utilization review manager. So what do you do with utilization review? What is that?
Well, utilization review is a process by which we ask and advocate on behalf of the injured worker with their insurance carrier. So what happens is there are a whole bunch of forms that we have to complete, and in completing all of those forms, ultimately we ask for whatever services would be in the best interest of the patient. So whether or not that is a work hardening program, chronic pain management program, functional restoration program, individual psychotherapy, physical therapy, anything that would be best in the interest of the patient to help them get better, that's what we ask.
So it sounds like what we're talking about with utilization review is that it's the pre-authorization process.
It is absolutely the pre-authorization process.
So we're asking for permission to do treatment.
We're asking for permission to do the right thing,
Okay.
which happens to be treatment.
And why do we have to ask for permission?
We have to ask for permission because the insurance carrier says that that is the only way with which they will adequately reimburse us for the services that the patients receive.
And what do we use, or is there anything that we use to determine what kind of treatment should happen in the first place?
Absolutely. In doing an evaluation, in trying to determine what needs to happen, we do a comprehensive evaluation of the person that's in front of us. So whether or not that's an examination of their physical functioning, an examination of their psychological functioning or mental health functioning, or whether or not they need any level of treatment, we do an assessment. And from that assessment, we do what we identify as a map, and that map specifies what the patient needs, when and where and how. And so we have to use the pre-authorization process to facilitate that.
And when an insurance company says, no, I'm not going to authorize that, what happens then?
We fight. And when we fight, we submit the request again. I personally reach out to patients to make sure that I am able to capture their story. And in capturing their story, I make sure that I'm able to clearly have an understanding of what happened to them. Because any of us could be walking out and trip and fall, and we would deserve to get the right treatment for our injury. So when they say no, we say, not yet. We're still going to apply for that request to be authorized, and then if we get a second denial, we go to something called IRO, which is our third request for that same treatment service. And then if none of that works, we then sometimes offer some pro bono services, because what we want to do is make sure that the patients get the best treatment that they need, while considering that they've gotten all lower levels of care before we go and ask for the biggest service, which is a multidisciplinary program.
You talked about talking to the patient, getting their story. How does that help you with the pre-authorization process?
Well, Mr. Lewis, if I'm talking to a peer doctor, and this process is called a peer review, I have to talk to other doctors across the country, and I want them to understand what happened to this patient and get a clear sense so that they are able to understand how this patient got injured, and that when they say that they have a sprained strain, that's real.
When you have the peer-to-peer call, when they call again and say, hey, we're reviewing this, we want your insight on this, how does that step in the process help you get pre-authorization?
So what happens is we submit the request to the insurance carrier. They then submit it to a peer doctor. That peer doctor then calls me and say, essentially, Dr. Fleming, why should we authorize this service? And then I am there to advocate effectively for the patient to ascertain and advocate to say why that patient deserves that particular service at this time. So knowing that patient's story is really what's helpful.
And so it sounds like your participation in this process is really a big deal in getting people from the need for treatment to recovered from their injuries.
That is absolutely right. I feel like we serve as that gap, because many times our perception is that the carrier's position is that the patient does not need some levels of care. So if we got denial of level of care up to the patient receiving the level of care needed so that they're able to return to their previous level of functioning, that's where the peer review process and that's where the the pre-authorization process occurs.
Well, if you're having a problem with pre-authorization or with getting treatment approved, if it's all being denied where you're at, and the doctors have exhausted their abilities to do something about it, come see Dr. Fleming and let her take care of it.
We're here for you.